Good morning, everyone, and welcome to Grand Ballroom B at GEEF 2025. I'm Yeona Kang, the Director of the Center for Global Sustainability at the Institute for Global Engagement and Empowerment. It is truly an honor to serve as your MC for today's sessions. So we begin with session 10, Global Warming, Disaster Preparedness, and Inter-Korean Cooperation. This session explores the intersection of climate change, regional security, and cooperative strategies for disaster resilience in the region. To guide our discussion, we are pleased to have two co-moderators, Professor Sunju Kang from Yonsei University, Graduate School of Public Health, will introduce the co-moderator and the panelists for this session. Please join me in extending a warm welcome, round of applause for our moderators and presenters.
Okay, thank you. I'm Sunju Kang, a research professor at the Graduate School of Public Health at Yonsei University, and I've just been introduced in before we begin. I'd like to introduce today's session's chair. The session chair is Professor So-Yoon Kim from the Department of Medical Law and Ethics, Division of Medical Humanities and Society, College of Medicine, Yonsei University. She is also the director of the Asian Institute of Bioethics and Health Law, at the World Health Organization Collaborating Center for Health Law and Bioethics. Her research areas include medical law, medical ethics, advanced biotechnology and clinical ethics, medical dispute, patient safety, and global health. Additionally, she served as the president of the Asia-Pacific Academic Consortium for Public Health Korea Region Office and the vice president of international cooperation at the Korean Association of School of Public Health. And she is actively engaging in international collaborations. This session will be conducted in a hybrid format, and all presentations will be delivered in English. Now, let's begin the session. Dr. Kim.
Thank you for the introductions. And then I'm very happy to have this session here. And then we made this session for today. And then I would like to introduce the first presenter. The first presentation will be delivered by Professor Luca Facci, who is currently an adjunct professor at the Faculty of Public Health, Thammasat University, Bangkok, Thailand. Professor Facci will be joining us online by Zoom. Professor Facci obtained his medical degree from La Sapienza University in Rome, Italy, and completed specialization in obstetrics and gynecology and internal medicine. He also holds a PhD in clinical oncology. After working in clinical practice in Italy and France, he has been involved in emergency and health development program in conflict-affected regions since 1996, collaborating with various international organizations. Notably, since 2004, he has worked with the International Committee of the Red Cross, ICIC, overseeing health programs in Africa, Afghanistan, Iraq, and Southeast Asia. More recently, he has served as the health coordinator for ICIC operations in China and Mongolia. Please join me in welcoming Professor Luca Facci with a big round of applause.
Good morning. I would like to thank the Institute for Global Engagement and Empowerment at Yonsei University and the Ban Ki-moon Foundation for the invitation to this 2025 Forum on Sustainable Development. My presentation will focus on public health in conflict and combined disaster settings, but I will also make references to the theme of this panel, which is basically on global warming, disaster preparedness, and the inter-Korean cooperation. To better frame the discussion today, I would like to start with some facts and figures and show in these slides how almost 25% of the world's population lives in situation of fragility, conflict, and violence. 100 million are in need of humanitarian aid, and more than 120 million people are forcibly displaced because of situation of persecution, natural disasters, violence, and conflict. You can see that one of the biggest consequences of humanitarian crisis since ever are the mass displacement. This is a picture from the genocide of Rwanda in 1994, up to more modern conflict, where we see that the humanitarian consequences on the population and communities are particularly harsh. We account today 120 armed conflicts all over the world. Most of them are non-international armed conflict, with the exception of the conflict that is taking place in Europe and in the Middle East as we speak. We have been observing over the last decades that climate-related disasters are also causing very severe humanitarian consequences to the populations. There is a great health of evidences regarding direct and indirect effects of a climate crisis on health, on the livelihoods, on the economy, on the sustainable development of many communities. Now, as I was saying, we believe that a public health approach is a structured and evidence-based framework that can allow the identification of the needs, prevent further harm once the crisis is started, and also promote recovery and resilience from the population. I will not elaborate on all these different dimensions around the public health approach, but it's very important to consider prevention and preparedness, which is also the theme of this panel, in terms of surveillance and early warning systems, the identification of the immediate and mid and long-term needs, because this is very important in order to set priorities and design intervention that can be inclusive and effective, and also the process of recovery and resilience, also working on mental health and psychosocial support, capacity building of local actors. So we understand that there are the foundations of this pyramid. You can see it's food security and water and sanitation, but then all the intervention can be built upon this in terms of prevention and curative. We have been seeing over the last years the occurrence of climate-related disasters in countries that were already enduring situation of instability and violence, like in 2023 in Syria, and the pre-existing challenges of the country really undermined also the process of relief and rescue and recovery of this population, because the systems and the resilience of the people were already under strain. Another example is what happened in Libya, where, as we know, the country is still in a situation of high instability and armed violence, and this massive flooding really endangered the rescue of the communities. The landmines that were planted in many areas of this country could move with the waters, and this was very posed a very serious risk. The combination of man-made and climate-related disasters in the same country, it's not an exception. In Sudan, what is happening now in terms of cholera outbreak, displacement of people, and conflict is a very serious humanitarian situation. The same can be said for what happened in 2016 in Yemen in terms of cholera outbreak, with more than 1 million cases infected and more than 5,000 deaths, also because of the disruption of the health system, the violence that was ongoing. What we see more and more nowadays is also the attacks to healthcare in this crisis all across the world. Attacks on ambulances, hospitals, health personnel, and these are not just the side effects. we can see also in the eyes of this Ukrainian doctor, the despair and the hopelessness to assist his patients in what was a hospital. WHO accounts more than 2,000 attacks to hospital structures since the start of the large-scale armed conflict in Ukraine. So we are always very much exposed in recent times to what is the buzzword of the moment, the polycrisis, which are crises that are multiple crises interconnected that converge and amplify the impact, creating a situation that is very difficult to manage. And the dimension can be very different, the political, climate-related, linked to pandemics, public health emergencies. So different situations that cause a cascading effect, to the point that we can see very clearly in these slides how drivers, triggers, and impacts, especially of climate-related crises, can cause at the level of the community. So when we talk about preparedness, the lesson, for instance, that the Philippines had in 2013 was not at the level, the reaction and the response was not at the level of success stories like in Japan for the earthquake or in Bangladesh for the early warning system for the cyclone. In this case, the emergency preparedness response was very difficult, but now there is an integrated steering committee and management system that looks at the policies, at the resilience of the communities, the communication of standard operating procedures, because of course the work of preparedness is really to prevent further harm and use transdisciplinarity in terms of different responses that are requested to assist the population. This compounding situation of different crises is very typical in the Sahel region, where pandemics, climate-related effects, shocks, and armed violence, food insecurity, and many other negative factors are really putting under strain the resilience of the community, but also the response of international organizations, because it's more and more difficult to provide answers. Lessons that we have seen during the COVID-19 pandemics that can prepare and can really help to better have plans of contingency in terms of prevention, because what was really missing at that in that period was the international cooperation and solidarity, the dilemma and the tensions between science and politics, and we can see that if we look at the foundation of this pyramid, if the building blocks of systems like workforce, information system, and the infrastructure don't work in an interconnected way, it's very difficult to make sure that the response is effective, inclusive, and sustainable, combining the life-saving approach and the long-term and resilience aspect. So when it comes to suggestions for an improved inter-Korean cooperation, for sure, there are two areas which can be considered very promising. One is the climate action, being adaptation and mitigation. So and the other is the health security, because what we have learned with COVID-19 is that the dialogue between countries was really missing. We know that these areas both can really be conducive for a dialogue, for reconciliation, for understanding between countries, and to increase also the mutual solidarity and support. So, we only think about early warning systems and response to infectious diseases, the management of water and resources. So when it comes to global health is also a very promising area, because health it's not just a service provided to communities, but can really become a connector, a contributor to regional development and global development to human security and ultimately to lasting peace. So we understand that working on the interconnectedness and the interdependency of the Sustainable Development Goals, it's possible for the international community to use these assets to ensure sustainable development, equality, inclusion, and also keep the promise that is no one left behind because of all the people we have said living in situation of fragility, conflict, and violence. So I thank you very much for your attention.
I would like to introduce the next presenter. The next presenter is we have here Dr. Yuichi Koido as our speaker. Dr. Koido is the Director General of the National Hospital Organization Headquarters, MHLW Japan, and the DMS Secretariat. He has long served on the front lines of emergency medicine and trauma surgery, gaining extensive experience in disaster response both domestically and internationally. Since the greatest East Japan earthquake in 2011, he has dedicated himself to disaster medicine and has played a crucial role in advancing the field. He currently serves as the chair of supporting committee for the Japan Disaster Relief Team and the representative director of the Japan Association for Disaster Medicine, actively contributing to the development of disaster medicine. Please join me in welcoming Dr. Yuichi Koido with a big round of applause.
Thank you very much, Professor Kim. Thank you for introducing me. My name is Yuichi Koido from the Japan DMAT Secretariat. DMAT stands for the Disaster Medical Assistant Team. First of all, I'd like to sincerely thank Professor Kim and Professor Lee for inviting me to this wonderful meeting and giving me the chance to speak. Today, I'll talk about how Japan responds to the weather disaster. First, I will talk about how weather disasters are increasing around the world, and Japan is no exception. Next, I will explain what the Japanese government is doing to deal with the flood disaster. Then I will talk about the strategy of the Japan DMAT for the flood disasters. First, weather disasters are increasing around the world, as you know. This chart shows the number of the natural disasters over time. Earthquake and volcanic eruption have not increased, but weather-related disasters, such as flood, are rising steadily. Around the world, flood are the most common disaster, both in the number of the people affected. It is also said that about 80% of the floods occur in Asia. Japan is no exception. This table shows the weather event named by the Japan Meteorological Agency. In the past, such event happened only once every 4 to 5 years. But now, we see the named weather event almost every year. Also, weather disaster can happen anywhere in Japan. So far, I hope you understand that while earthquake response is important, weather disaster, especially flood, are more likely to happen. Therefore, we need to be well prepared. Next, I will explain Japan's response to flood disaster. When responding to weather disaster, the biggest difference from the earthquake disaster is that the weather disaster can be predicted to some extent. There is sometimes before they happen, and thank you. And what we do during this time is very important. In past flood, Japan was not able to use this extra time effectively. The response was often delayed, and hospital evacuation sometimes had to happen at night. Based on this lesson, the government is now working on creating the flood timelines. A timeline means deciding in advance who will do what and by when if a flood is expected. In Okayama Prefecture, based on the lesson from the 2018 Western Japan heavy rain disaster, a manual has been created to help the facility for the vulnerable people develop the timeline. Japanese government is leading the efforts to promote the awareness. This is the data from the United States. After the painful experience of the Hurricane Katrina, they learned the lesson and created the timeline. When they used this timeline during the Hurricane Sunday, there were no casualties. This table shows the measures Japan is taking to protect the vulnerable people during a disaster. These vulnerable people can be divided into the three groups. Those in the medical or welfare care facility, and the second, those receiving home medical care, and the third one, those visiting hospital as outpatient. Medical and welfare care facility are required to create the business continuum plan, BCP. Facility located in the flood-prone area on hazard map must also create the evacuation plan and conduct the evacuation drill. Previously, both planning and training were only the recommended goals. That means the effort-based duty. However, after the typhoon number 10 in the 2016 caused severe damage to the welfare and the nursing care facility, resulting in many casualties, the law was changed to make both obligation. This table shows the presence of the disaster plan and implementation of the training for different type of disaster. Middle of the flood, the number of the facility located within the hazard map area nationwide is almost 125,000. Of those, 88% of the facility have already created the evacuation plan. However, only 39% have conducted the evacuation training, which is still not enough. For home medical care services, provider must have the BCP. Also, cities and towns are advised to make a list of the people who need help in an evacuation and create an evacuation plan. Almost all cities and towns have already made these lists. Next, I will explain about Japan DMAT strategy for the flood. DMAT, Disaster Medical Assistance Team, has responded to the many disasters since it was established. Since the 2016 Kumamoto earthquake, there have been the 8 disasters requiring the DMAT deployment. 4 of them were weather-related disasters. In all disasters, DMAT carried out the evacuation and transportation of hospitalized patients. In past disaster response, information was collected after the disaster happened. Because of this, the response was always delayed. Recently, to take action before a disaster happens, we have been creating a list of hospitals that are vulnerable to disaster. In the EMIST, Emergency Medical Information System, hospital database, information such as earthquake resistance, backup power capacity, water tank capacity, and stockpiles is recorded. Based on this data, we identify the hospitals that are at risk. Sharing the information about these vulnerable facility across the entire region is called the DCOS method. DCOS means the disaster damaged hospital continuation support. For example, if the Tokai earthquake happens, the 4 affected prefectures will need a certain amount of the fuel for backup generator and water supply. This table shows the estimated amount required. So approximately the 50,000 hospitalized patients are expected to evacuate earlier, etc. By preparing the list like this in the advance, in the event of the flood, responses can be prioritized based on the list, rather than the gathering the information after the disaster occurs. Finally, I will present my summary. Weather disaster are progress disaster, allowing the lead time before the occurrence. It is crucial to determine what action to take during the lead time, including in the normal times. DMAT identifies hospitals with a high risk of the disaster impact during the normal time. After the disaster occurs, support is provided based on this list with prioritized assistance. Hospital evacuation should be avoided as much as possible by ensuring the supply support. Thank you very much for your attention. Thank you.
Thank you very much for insightful presentations. Yeah, the final last speaker is Professor Sunju Kang. Professor Sunju Kang is a research professor at the Graduate School of Public Health, Yonsei University, specializing in global health, nursing policy, and disaster preparedness. She began her career as a military nurse officer and later served served as Vice Director in Nursing at the Korean Military Hospital. She has also dedicated herself to academia, teaching disaster management and emergency medical care at the Korea Armed Forces Nursing Academy, Gyeongdong University, and Jeju Halla University. Since 2019, she has been leading the Medical and Humanitarian Emergencies Intensive Course in collaborating with the Johns Hopkins University, equipping professionals with expertise in disaster response and humanitarian crisis management. In recognition of her contribution to global health and disaster preparedness, she received Global Nurse Consultant Certificate from the International Council of Nurses, ICN, in 2024, and the Certificate of Merit from the Socialist Republic of Vietnam in 2021. Please join me in welcoming Professor Sunju Kang with a big round of applause.
Thank you, Dr. Kim, for your very wonderful introduction. And today I will talk about climate change and disaster preparedness, focusing on challenges South Korea to faces in responding to disasters from North Korea. I will cover, my presentation cover disaster risks from in North Korea and South Korea's preparedness, current situation, and their future strategies. And North Korea has experienced several various climate-related disasters in the past 20 years. Here in the table, the priority was flood. So they had 18 times flood, and it affected total 1,500 deaths and also affected over 10 million population, and they have a very huge economic losses, almost over $16 million. And also poor wastewater management increases the risk of pollution and also the infectious diseases in a broader area. Nowadays, we have North Korea has sent several times waste balloons to South Korea. So it causes, these balloons are both physical threats and also psychological and environmental concern. So here, the images illustrate, I just made these images. These images illustrate a hypothetical scenario. If instead of waste, biological hazards were placed in multiple balloons and dispersed across the various regions in South Korea, it could trigger nationwide chaos and require urgent risk management. Do you agree? So now, South Korea has a national disaster management system based on the Framework Act and also the Management Disaster and Safety Act. In the picture, this is the hierarchy organization chart under our government, under the ministry, and for health is the Ministry of Health and Welfare, and we just collaborate from the national and provincial level and the community level. So when we have an emergency situation, we have under the emergency medical system. When we have we just secured the emergency medical center, also trauma center in each designated provincial level. And when we have just emergent patient calling on 119, they dispatches the ambulance to the on-site. And after the paramedic, they just provide emergency treatment before they transport to the appropriate hospital. So in the right side is the instant means in the inside of the hospital, how they just manage it when they have an emergency patient. But we have a limited capacity of medical professionals, especially like private hospitals, and just volunteer to respond to the unexpected disasters. So for the each year, emergency medical personnel, they should take the mandatory training. So most, and also the training for the CBRNE is conducted by the very few institutions, National Radiation Emergency Medical Center, Korea Armed Forces Nursing Academy. They just provide disaster management and trauma nursing courses, and also Korea Armed Forces Medical School, they just provide the CBRNE training. And as for the public disaster relief training, 시그니처, they provide certain training, or also Korea Red Cross provide only for the first aid and CPR courses for the general population. Here in the picture, the first on the top is the simulation training for the offered by Public Health Center for the bioterrorism. And also the second middle top is the mass casualty triage simulation. And also the right side, the top is for the, nowadays we have lots of urban disasters. So this is simulation using high fidelity, and the bottom is the donning and doffing of PPE, and the middle of the bottom is the airway, the intubation training, wearing a first level 1 PPE, and the right side, the right bottom is the decontamination training. Also, those kind of trainings are offered by as one of the CBRN training. And also, Korea Red Cross, they run 6 hospitals, 5 hospitals, and 1 rehabilitation hospital. They also provide training courses on just the general population, but they only focus on CPR and first aid courses. And also for the emergency situation they provide, they already secure 1,400 member emergency radio, and also they stockpiled over 10,000 household specific relief supplies. Now, I'd like to just briefly mention about the German's multi-level disaster management model. Germany also, they just closely respond to the disaster from the federal government and 16 landers and local governments. Usually federal governments, they have an office, a federal office of civil protection and disaster assistance called BBK. They just in charge of the in war and how to protect it, in charge of, in a situation of war and national crisis, to protect civil population. And this is the, there are 7 divisions under the crisis management and under the directory of, because the PPT slide is in the middle, it's very, so under the Federal Ministry of Interior and Community. So you can see here the BBK and THW. THW is the Federal Agency for Technical Relief, for when they just German Red Cross, they just provide the relief to the population, the THW they support. And also here, so it's the German disaster management system, they have very closely interacted from the federal and local government and community. And also in the community level, biological hazard training was provided at the community level. So another, and also they just already secured the large-scale volunteer training system. So over 1.7 million trained, they secured the volunteers, and also special trainings are provided from Federal Academy for Civil Protection and Civil Defense and THW. And also they just have 400,000 trained volunteers are secured, and actively they are participating when they have a disaster. And another one thing is very impressed. So I just visited Germany last month, and they have okay, financing is a forecast-based financing. They just allocate funds based on the prediction, what they will have in the future, so they allocate their resources. So, based on our Korean situation and some good point from the German, I just recommend how can we just respond more. But in the Sendai framework, it's building back better, but I just change it, building forward better here. So we can shift our framework more and advancedly, proactively, building back better to building forward better to identify, because we can expect it down the waste ballooning. So how can North Korea cannot affect our South Korea? So we can to analyze what can we have in the future, unpredicted disasters, so we can building forward better. And also, based on our current situation, we don't have that much. There is a very specialized like a radio medical center and armed forces based training center, but we don't have that much private hospital or private university-based training center. So also we only just focus on ACLS, TLS, but not CBRNE. CBRNE means chemical, biological, nuclear, radio, yeah, something like that. So this is what I just recommend. More community-based voluntary training, like a model adaptation from Germany, and focus-based financing and pre-allocated disaster funds, and more early warning system. We need to just back up our Korean disaster management system. This is the final slide for the key summary. So we need to building a more proactive, building for the better disaster management system and strength into Korea. Because I just focused on the unpredicted threats from the North Korea, but if South Korea, we just prepared more, we can, in the future, we can support our North Korea. So thank you.
Thank you very much for the inspiration speaking, and thank you. And do you have any questions for the presenters? Professor Lee, you might have some questions.
Thank you. It seems like even internet-based disaster today, but despite, yeah, but despite the interruption, today's lecture is insightful. I would like to ask questions. Thank you for your presentation. I'm Jung-im Lee, research professor at Graduate School of Public Health, Yonsei University. I would like to express my gratitude to Professor Koito for sharing insight on disaster situation today. Could you please share your thoughtful on disaster situation and disaster response in North Korea? Thank you.
So very difficult question to me, because the Japanese DMAT usually deal with natural disaster, and we don't deal with conflict mission. So the Japanese DMAT basically consists from the normal person, the medical staff. So it is difficult that the DMAT deal with conflict pattern. So in Korea, if something occur in the North Korea, but maybe there will be many casualty. So someone have to save them. So it's important to think. Please image. Please have an image to scenario, and to make a scenario, and to do the most important things to is training and other at the worst scenario. Very sorry, not answer. But yes, thank you.
Thank you very much for the questions, answers.
Your Dr. Lee's question, because I have a very good impression your presentation, because Japan's disaster management demand is very well organized to respond to flood, but also I just imagine you have a very good system to respond to earthquake or volcanoes. So we just heard the risks from North Korea's volcano or some. We are not safe to exposure to the earthquake, so we can just learn from your various long time experiences in floods and disaster earthquake respond. Yeah.
Thank you very much. It's very short time this seminar, but we will learn and communicate each other for the right after these sessions, and then we will learn from Japan a lot. And then can you ask you how the situation if the North Korea have some disaster, how we can help for Japan and from South Korea? How do you think?
It's too bad I could not present, because the conclusions of my presentation were very similar to those of Professor Kang, where beside disaster preparedness and risk reduction being a very conducive area of cooperation between countries. So I do agree that this is a very fertile ground where we want to start or to improve the dialogue between countries. Definitely early warning system, disaster preparedness, risk reduction is an area to explore, especially within the Korean Peninsula. Another areas that has not been, I think, touched, but I wanted to share, to emphasize it in my presentation, is what we have learned in terms of lessons regarding the COVID-19 pandemic. Because I think that if we look at a little bit at large, global health is teaching us and is giving us a lot of insights in terms of also international cooperation, solidarity, dialogue. What happened during the COVID-19 pandemic was not really positive experience worldwide because of this, because every country went for itself. There was this tension between science and politics, and I think that this could be an area that the preparedness for the next pandemic, as we know, it's very possible that we may have another situation as we had with COVID-19, could also be a very good areas of dialogue, mutual understanding, cooperation. We have experiences in other countries, in other contexts, where there have been situations of violence or conflict, where through global health, and I would say more global health diplomacy, so using all the elements that entails global health, also to make sure that the dialogue can resume, that there is an understanding between the sides. So I think in association with the disaster preparedness, also global health diplomacy can be really something that can help within the peninsula, but also globally, because I think that what is being done now on the pandemic treaty and on the international health regulation can also help a lot in terms of dialogue and understanding, even if countries have difficult relationships, and this can really be helpful. When I was in China until last year, the main program of the International Committee of the Red Cross, run by my department, was exactly on global health diplomacy, but looking more at these 120 armed conflicts that are ongoing worldwide, where China and also the other countries can be really important players in terms of diplomacy, conflict mitigation, conflict resolution, and preparedness. Thank you.
Okay, thank you very much for the comment. And then I hope, if possible, next year we can invite North Korean representatives to discuss together for the disaster preparedness. And then, do you have any other comments? Yes.
Oh, yeah. So I totally agree your Dr. Luca Farki's opinion. So when I visited German BBK, I just asked them how you're very strong community level training on CBRNE. So they just reply, Army, they have their own role. But in Korea, when we have a biological or nuclear or chemical hazard event happen, what we will do? So we can just ask for our military, but they have their own role. And during the COVID-19, we didn't have enough medical staff. Yes, so that's why in a community level, we have more prepared for the training. Yeah. Thank you.
So, do you have any other comments? If in Japan, if you have disaster, it is very near country, South Korea, and can you go there? And how do you think about this kind of connection and co-op?
Yes. So actually, we are trying to collaborate with the KMAT, a Korean medical assistant team. So 5 years ago, from 5 years ago, we did the collaboration drill with KDMAT. So that collaboration and relationship is very important to the next disaster.
Maybe North Korean disaster, Japan also come to.
I want to come,
yes.
but the government, I don't know. Allow me if government allow us, I want to come here, to save the people. Yeah, of course.
Actually, last week we visited Japan and then see about the demand situations, and I think we should learn a lot from Japan. They prepared very well. At least 30 years ago, you prepared for some earthquake situations or something. Yeah. So I hope we can learn from each other, and if they have some situations, we can co-work together. At some conference, I heard that for the disaster conference, prepare as it is the severest situations. Yeah, and then for that severest situation, preparedness can make real situation better outcome. So we think most severe situations, and then we should prepare that. Thank you.
What's the scenario? Yeah.
Scenario. When we make a scenario, the most severe case we can expect, and then prepare the cases in that, and then in real situation we can do more a good result. So we do not know that North Korean mountain volcano when it can be acting, and then or other North Korean origin disaster or natural disaster. So we can, but if we do not think of we can be dispatched to the North Korean, we do not prepare. So in this situation, we should think about the kind of situation also. So we should learn how this current North Korean situation is, and then what is the most thing for the currently we should prepare for the severest situations. So that's why we are doing this session, and then I think this session can be continued in somewhere. Yeah. Do you have any questions? Oh, yeah. Thank you.
Thank you so much for your kind of insightful and thought-provoking lectures. Just a brief question about what is the main hindrance? Okay, myself. Okay, I am Gil. I'm just working for the Global Care. I'm really interested in disaster and preparedness. And especially Professor Kim, you just pointed out, there is a gap between community-based and driven some preparedness with a higher level of government as well as some local as well as federal government. There is a gap. What is the main hindrance point between, there is a huge gap between the higher level as well as lower level? And then how can we just overcome that kind of obstacle? What is the best, especially in terms of the Korean Peninsula? And then also, you're talking about collaboration and solidarity. And what is the main, I mean, some of the recently cases, what is some episode you can say we have a very good collaboration with international organizations from the Korean side? And do you have also some of the example? You are talking about Germany cases, and do you have any some best example, not only Japan, but like USA and some other European countries, how they deal with those disaster and some natural disasters as well as some biochemical hazards? Thank you so much for that.
Can you? Yeah,
Thank you for your very good question. You just asked me several questions. Why I visited Germany? After the Korean War, German Red Cross, they dispatched their hospital. Actually, they operated a hospital in Busan for 5 years. And also German, they supported North Korea until 2000. So I just, and in our national system, we just modified or apply the German system. So it's very, we have just good collaboration. So, and also German Red Cross, they're the area or scope of their activities more broader. So I just heard that but they are not the NGO, very independent organization. And also, so they are very contribute to the community level preparedness, not only first aid or CPR, but CBR needs. Because we have less of retired experts, so we have full capacity. They have full capacity. But in Korea, we have very good, nice health system and public health center. Government, local government, they are very prepared. But inside of the private sector, we don't have that much center to provide training programs. We have certain centers, but not equally distributed in a nationwide. That's why I just mentioned.
Yes, thank you for the comments. And then I also, last week I heard that 800 hospital was prepared for the disaster in Japan, but we do not prepare like that. So, yeah. And do you have any experience come to other countries? You may have many experience to dispatch DMAT to other countries also?
Japan DMAT only deal with the domestic disaster, but also we have JDR, Japan Disaster Medical Team, and under the MOFU, Minister of Foreign Affairs. JDR the beginning from 40 years ago, and the JDR number of the JDR mission already more than 60. So that means we have also the very experience about international disaster too. Yeah.
Yes, thank you.
But the DMAT is the JDR is completely different.
Yeah. Okay. In many situations of the fires, big fires, or earthquake, many international cooperation is currently done. Yeah. Okay, thank you very much. But I'm emphasize that North Korea, South Korea, Japan, China is very nearest countries, and we can work together, help together each other. Yeah. Okay. Do you have any comment or last questions or comments or yeah? Dr. Faisal, yeah.
Yes, thank you. No, I just wanted to raise. I was in 2013 in the Philippines when Typhoon Yolanda hit the country. You know, this typhoon was one of the biggest natural disasters in modern history, with a lot of losses, destruction, and what I've seen in terms of international deployment was really impressive. As you said, there were all the countries very close to the Philippines, but also Red Cross, National Society from the Red Cross from Europe, from the US. So what is important is that at that time, the emergency preparedness and response of the country was not so developed. So the contribution that all these international actors would bring was huge, because then the country developed a plan where I do agree with you that there is a gap with the gentleman who made a question. There is a gap sometimes from the top of the emergency preparedness mechanism and the community. And one way to make sure that communities know how to behave in situation of disaster is exactly to make, to test these plans, to make drills, to make scenarios, to make simulation. So the Philippines, they started working very hard on that. You know that this is a country which is very prone to natural disasters because of its geographic location, very close to the Pacific Ocean. So I think that what they managed to avoid since 2013 until now is also thanks to a more elaborated and developed emergency preparedness and response plan. That was also possible through the contribution of international actors, as we have reminded before. Yeah, thank you.
Thank you very much. We have all the time to close this session, and then we should not trust the government only. The private sector, we should prepare also, I think. Yeah, thank you very much, all the panelists and all the participants here. Thank you very much. We will close. Yeah.
Thank you, speakers, for your impactful insights and for highlighting the importance of international collaboration in climate resilience. We'll now take a brief break before moving on to the next session at 10:50. Thank you.